How many chiropractic treatments does it take to relieve sciatica? Hi, I'm Dr. Dave Candy. I'm actually a doctor of physical therapy, not a doctor of chiropractic, but we do provide a lot of manual physical therapy or spinal manipulation techniques at More for Life. And so sometimes when people are searching for the types of services that we provide, they search for chiropractic treatment. And we actually see a lot of patients who have seen chiropractors in the past. And this is not to bash chiropractors or say chiropractors are good or chiropractors are bad. This is just to help someone watching the video to understand how many chiropractic or spinal manipulation treatments you might need with a physical therapist in order to get better from sciatica. Now, there are a lot of things that affect sciatica, and those can all vary the number of visits that you'll need during the course of your treatment. The severity of it matters, how far down your leg it goes matters. In fact, when a lot of people think of sciatica, they refer to it as pain either in their buttock or in the back of their leg, or sometimes all the way down the leg into their foot or into their toes. And when some people say sciatica, they really just mean buttock pain. And other people, when they say sciatica, they mean the full gamut of all the way down the leg into the toes. So that just goes to show that sciatica itself is not a very great or very descriptive term in terms of telling you what's actually wrong or what's causing it. Now, spinal manipulation treatment is a great type of treatment for some types of sciatica. What the research shows is that spinal manipulation is really good for types of sciatica or back pain that have just come on in the last 2 weeks or so and doesn't go past the knees. Now, that's not to say that things that have gone on longer than that don't respond well to spinal manipulation treatments, but really recent things that are more localized, just back pain or just buttock pain, or even down to the back of the knee, are typically the things that will respond better to sciatica. Now, when should you not see a chiropractor or when should you not get spinal manipulation types of treatment for sciatica? Well, in the case where you have a truly pinched or compressed nerve, where in the worst case, where you're losing bowel or bladder function, where you're having accidents or you can't hold it or you can't go when you want to, that's more of a medical emergency where you should go straight to the ER and skip the chiropractor, skip the PT, and just go to the ER. Now, in the case where you don't have that, but maybe you have symptoms that go down past the knee, maybe you have some numbness or tingling in your leg or foot, or maybe you have some weakness in your foot where you're getting a drop foot, or you feel like you're a little bit weaker, like you can't push off as well when you're walking. All of those things would be more of a sign where the nerve isn't just irritated, but it's actually being compressed or pinched. And in that case, if you do aggressive spinal manipulation treatments, regardless of whether they're performed by a chiropractor or a physical therapist, you can actually make the nerve compression a little bit worse. Now, sometimes manipulating in other areas besides the area where the nerve is pinched can be a helpful part of the treatment, but ultimately, the main goal of your treatment, if you have weakness or numbness, particularly below your knee, is to take the compression off of the nerve without further damaging it. Now, as to how many treatments that will take, it's hard to say because a really, really badly compressed nerve is going to take more treatments than a nerve that's not as badly compressed, which is also going to take more treatments than a nerve that's barely compressed, it's just irritated, and maybe you just have back or localized buttock pain. But you should see improvement within the first few visits. I have seen patients in the past who have been signed up for 4,000, 6,000, $10,000 chiropractic packages where they're expected to go for a year and they're just not getting any results from it. And that type of treatment pattern, I think, isn't warranted. That regardless of who you're seeing for your sciatica, whether it's a chiropractor, whether it's a physical therapist, you should see some improvement within the first few visits. That's not to say that it'll be completely resolved in a few visits, but if you're not seeing a little bit of improvement within the first few treatments, then it's probably time to look for something else. So, what else can you do to supplement spinal manipulation treatment in order to make it last longer? Ultimately, just manipulating your spine, it isn't going to fix the root cause of the problem, that something caused that nerve root to get pinched in the first place. And that might be body mechanics, it may be the way that you move your body. It may be stiffness in muscles. It may be weakness in other muscles. But regardless of whether you have chiropractic treatment or physical therapy treatment consisting of spinal manipulation, you also want to do the things to address the muscle imbalances, the stiff muscles, the weak muscles, the ways you position your body at nighttime and during the day, the way you move during your functional activities, so that that spinal manipulation treatment, it isn't just a thing where you have to keep going back to the chiropractor week after week, month after month, getting maintenance visits for months or years on end just to keep the problem from coming back. You want to learn what was causing the problem in the first place and how you can address those root causes on your own so that it empowers you to take care of your own symptoms if they ever should come back. Now, if you're in the position where you've had a lot of spinal manipulation treatments in the past and you're starting to wonder, is this really the best thing for me? Is this really working? Chances are, if you're starting to think that, it probably isn't. It's probably too late at that point, and it's probably time to seek out something different. And if you're just at the beginning of your journey and you're wondering how many should it take, look for some improvements within the first few visits. And if that doesn't help at least a little bit within the first few visits, move on. Now, if you do need some other solution and you've had a few spinal manipulation treatments that haven't worked and you happen to live in the St. Louis area, we'd be happy to help you out at More for Life and help you figure out what is at the root cause of the problem and what you can do to address it to help take care of the problem for good. And if you're watching this from somewhere else, but it helped you decide how many visits you should be seeing a chiropractor or a physical therapist for spinal manipulation treatment, then give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.